Good morning. Welcome to MS There Is Hope. This morning we will be talking to Tressa Pinkleton from Seattle, Washington. Tressa's nice enough to visit with us while she's in Miami, la di da. Uh, Tressa, thank you for being with us and taking time to spend with us. There's something that we talked about last night I want to bring up real quick. Dr. Pinkleton doesn't make money off these interviews, neither do I. We don't do this on account of money. We do it to help people. And I want to put that out there and say, don't give her any grief because she's doing this for free. All right,
Thanks, John.
I'm going to read this little disclaimer and then we're going to go right into some questions that we have for Dr. Pinkleton today. This interview is of our own personal experiences, and we're not talking in specifics, but in general about our experience while doing the Coimbra protocol. We are not giving medical advice or addressing individual cases. Cases and results can vary using different methods. Medical protocols and methods of treating MS should be done with a licensed medical professional. Again, thank you, Dr. Pinkleton, for being with us.
You're very welcome. Thank you for having me.
I'm going to try to jump to the 21st century here and get on my phone. All right, our first question. Do you have to take vitamin D3 all at once or space it out throughout the day?
Yeah, that's a good question. It's one that I get asked just about every first appointment I have for people wanting to get started with the protocol. So vitamin D is a fat soluble vitamin, meaning that it needs fat to absorb into our system. And then also it's going to absorb very readily for most people. And what is not used immediately will be stored in one's body fat. This means that we don't need to kind of space out vitamin D like we do with other nutrients or other vitamins, like in the CP multi or what have you. Some people like to do it that way, especially if they're using like gel caps for their dosing for the protocol, because it can be a little bit obnoxious to take like 15 tiny little gel caps. But what I tend to recommend liquid versions of vitamin D, and I say just take it all at once first thing in the morning. That's what I tend to recommend. Vitamin D can also at high doses be a little bit stimulating. So I've seen some people have trouble falling asleep at the time they're typically accustomed to if they've taken a big dose of vitamin D around dinner time.
One other question along the same lines, is it okay to take dry vitamin D, or I've always been told oil-based or liquid vitamin D was better? What's your thoughts?
The dry-based vitamin Ds I find work fine if they're taken with fat. And so people that work with me, I'm able to give them access to a 50,000 IU capsule to use, and which really helps to cut down on all of the pills.
Oh yeah.
But I always say you have to take this with fat. So like some coconut oil, or half an avocado, or if you're a meat eater, like a piece of bacon or a couple pieces of bacon. Like you need to take it with fat for it to actually be able to absorb.
All right. Is distilled water best to use?
That's, it really depends on the person and their diet, I would say. When I've had patients that have found themselves in hypercalcemia or leaning that way, I will recommend to them, if it's appropriate, to switch to distilled water to just help bring that mineral count down. But drinking distilled water, it's not, in my opinion, necessary for the protocol. I use it for specific reasons.
I get asked that question often too. I have a filtration device that removes calcium, but leaves some other things in.
Yeah.
Our next question is, I understand having too low calcium is bad as too high. If our calcium intake is on the low side, can we up it by eating just a few grams of forbidden items like nuts or cheese?
Yeah. Well, so this has been a very hot topic question in my practice. And it's a maybe. That's kind of how I approach it. I have definitely found, well, what I tell patients when we're seeing that clearly their calcium intake is too low, and I'm talking about, I've had some patients track their intake and they're having less than 100 milligrams of calcium per day, and that is just far too low. The recommended daily amount is around 1,000 milligrams for most people, and so getting just a tenth of that is way too low of a low calcium diet. I first really suggest, trying to increase it with vegetables, because that's also going to bring in a lot of other minerals into your diet, which is going to improve your health tremendously, as well as really, much needed dietary fiber that we don't have a lot of in our society, and how we eat here in the United States. Sometimes patients will be permitted to open up into like having some nuts or seeds, etc. I have found that with my patients that have used dairy to try to increase their calcium intake, that they can go too high, and they'll be really confused because they're like, but I'm looking and it says 150 milligrams. I only had one slice of this. And it's led me to believe that maybe the calcium content in dairy just really varies based on how those cows ate, where they were in their stage of life. And it might not be as standardized as a nutrition label makes it seem to be. So I don't recommend trying to use dairy to get one's calcium up. Nuts typically I've seen be okay, not all the time, but most of the time. I tend to only open up the diet like that to those quote unquote forbidden foods when the calcium is clearly too low. If the person's just skirting right under the recommended amount of daily calcium intake, I really try to push more for using like dark leafy greens, broccoli, just those vegetables that have the minerals, as opposed to having a bunch of almonds or walnuts.
One thing I'll add to that is people, you got to do your math. Sometimes people are saying, well, it's 5%, so I can have it. Well, yeah, 5%, but don't take 3 or 4 serving sizes. Keep it down. And if you do, 3 or 4 serving sizes is the same as if you were doing 15%.
Well, I will say, it's something I bring up in my practice is I'm not a big fan of those percentages rules. I really think it's what has pushed people's calcium intake too low on this protocol. And so I really counsel to my patients, don't pay attention to those percentages rules. Dr. Coimbra did not make them up. I was not trained in that methodology. It's what some people that have attempted the protocol on their own have kind of created to help guide them. And I've seen it do more harm than good.
All right. Our next question, I got a text right in the middle of this, and so my screen changed. All right. Our next question is: jumping on a rebounder or trampoline as good a form of exercise, of exercise for bone density?
I think that it can be okay. I really prefer if somebody can, has the mobility to pick up some hand weights and move their body around, to do it that way. There are studies that show that jumping on a trampoline or a rebounder helps with DEXA scores or, bone density scores. But those studies haven't been used on people with the protocol, like that are doing the protocol. And so I get a little uneasy if somebody's trying to dial it in by just jumping up and down on something. If you can have the wherewithal, not wherewithal, but if you have the mobility to be able to do something like a trampoline, then you do have the mobility to be able to do some strength training. And I think that definitely, I've seen that work. I've seen that improve DEXA scores with people on the protocol. And so I try as much as possible to get my patients to do something a little more
weight bearing.
Yeah, weight bearing.
Mm-hmm. Yeah, weight bearing. Like myself, I can't do the trampoline or walk, but with my upper body, I still do weights, still take care of the pythons, So, and I love it. I love it.
Yeah.
After you get into it, and it really helps you stay loose.
Another thing that can be nice about strength training is that, especially if you have the ability, if one has the ability to have a gym membership, there are some of those machines where, I mean, you might not have good balance, but you can sit down and do a leg press, you know?
Yes.
So you can still work with some limitations while also keeping your skeleton protected from the effects of high dose vitamin D.
I always tell people do what you can do and don't stop that, because when
Yeah.
you stop, it's especially as you get older, you just see it goes away, it goes away, it
Yeah.
goes away.
Mhm.
All right, our next question is, if I like this question. If you were to prescribe one supplement beyond the Coimbra protocol, basics or staples, what would it be?
I might buy out of that question. That's so difficult for me to answer. As a naturopathic physician, I am trained to treat the person, not treat a disease, not, you know, I don't really blanketly prescribe things. I do blanketly prescribe vitamin D to pretty much all of my patients in the wintertime. That
Right,
makes sense, right?
right.
You know, honestly, I would prescribe a diet filled with vegetables, 5 to 6 cups a day. That's what I would prescribe. Um, Anything to go along with the protocol, but a particular supplement, it really depends. Some people have a hard time with sleep, and so I would give a certain herb. Some people have, anxiety or other mood things, and I would give different nutrients for that. And it really just depends on what's going on with them.
I think that's a good answer. Uh, Someone says here, can we eat sprouts, or are they too high in calcium?
I think people can eat sprouts.
I do.
If somebody's trending towards hypercalcemia, we clearly know that they're not eating too little calcium, and I find out they're having like 10 cups of sprouts a day, I might change my tune. But in general, I think sprouts are fine.
That was all the questions that were submitted. Uh, I believe. Excuse me.
Honestly, there was a question which I think is a really good question. Somebody asked, "Hey, with the CP multi, if I forget a dose, can I double
Yes.
up?" And to
Yes.
that, I say yes. Are you going to filter, your kidney's going to filter some of those B vitamins out? Sure, but it's best to get the other nutrients in as if you can. Spacing it out is ideal, but if you can't do that a couple days a week, it's not a big deal. Just be aware that there's 100 milligrams of magnesium per CP multi, and so you could hit that bowel tolerance level if you double up a dose without adjusting the other calcium, or excuse me, without adjusting the other magnesium that you take. And yeah, and then somebody else I think asked a question about the medical medium and what I thought about his guidelines. And I did want to say something about that. I want to preface with saying I've not read his material, but I've had many people come to me, following his advice, both on and off the protocol. And I have definitely seen that celery juice recommendation cause kidney stress, even with people not taking high dose vitamin D, like putting them in levels that look like kidney disease. So I would really caution some of his recommendations.
Here's the question I forgot. Since there's so much talk about EBV lately, I don't even know what that is. Maybe she could discuss so the medical medium protocol that is safe versus not safe with Coimbra.
Yeah.
I don't know.
Well, again, I'm not familiar with his total protocol. I do know that he really gets into EBV, which stands for Epstein-Barr virus.
Oh yeah, that's it.
Yeah, Epstein-Barr virus in my field has been discussed for years as being one of the causes of multiple sclerosis.
Yes.
And
Yes.
conventional medicine has finally started to work its way around to this, idea. It's a thing that I do address in my office, and I will sometimes test for it if people aren't responding to the CP as we would expect. Typically, we do find that they're viral titers are really, really high, and we, there are things I do for that. But in terms of what the medical medium protocol is, I'm not familiar with that protocol, but I do know that it has this whole component of drinking ounces and ounces of celery juice every day, and I have seen that cause harm.
Do you have a couple more minutes? I know you're stretched for time. I got
minutes
mind?
Today. I'm on vacation.
Oh yeah, that's right. I wanted to get your thoughts on a journal and what your thoughts on a journal was. I often tell people to keep one. I think they're important, and this is why they're important. I believe is that you get worse somewhere down the line, and you're like, I'm not getting anything better. This sucks. It's not working. And you go back and look and you think, oh my goodness, how much I forgot, how bad I was and how far I've come. That's why I say keep a journal. And then also, if somebody's going through something, sometimes you can go back through your journal and say, yeah, I kind of went through that too, or I don't know, maybe you can just go back and say, I remember days like that, when I was in my 7th or 8th month. That's my opinion.
I think that journals can be really helpful for people that really like to journal. If somebody is the type of person that writing helps them to process and they like to keep records of things, then journaling is a really great choice for them. Other people, that feels like an extra thing to do during the day, can stress them out, and it's not how they process their issues and what have you. And so for those people, then I don't think journaling is appropriate. I do love how with a journal you can go back and review, and that is one of the reasons why every single visit just about that I have with a patient, whether it be a protocol patient or somebody's coming to see me for stress or anxiety or fatigue, I will go through, there's like a list of questions called a review of systems. I go through that just about every visit, because you do have these appointments where people are saying, this isn't working, I don't feel great. And I'm able to go, let's go to your first visit with me. Let me tell you all of these symptoms. Do you still have this? Do you still have this? Are you still experiencing this? And they're like, no. Well, maybe that one, yeah, but not at that level anymore. No. And it can put into perspective how far someone's come. Yes. So that's it. That's another great reason to work with the protocol doctor, because they can help keep that record for you if something like a journal just doesn't fit your lifestyle or your personality.
What really cemented this thought to me was a couple years ago. I read my journal and it said, this spasm in my right tricep is driving me nuts. I don't even remember ever having spasms in my tricep. I just don't remember it. But for some reason that day it was just shaking and driving me crazy. And I did have a couple of symptoms that would literally drive you insane. I had this, I call it a moth, fly into my ear. That's what it was like. Imagine a moth flew into your ear and was flapping its wings. And I would sit there in the chair and constantly that was going on. And it drive you insane. I mean, I'm nuts as it is, but I mean, that would push me over the edge, Anyway, that's all the questions we have. Do you have anything to add? How's the weather in Miami?
Oh, I've been told by several people it's the coldest it's been in a year. So I brought the Seattle weather with me, I suppose. But it's been really nice to just take a break. And,
cold to people in Miami's like 55.
I know it was 75 yesterday. I thought it was perfectly balmy. So I'm visiting a friend that I haven't seen in a while, so it's been good to reconnect with her. Yeah.
Good for you. Well, thank you for taking time out of your vacation to answer a few questions. We'll meet again in a couple weeks and do the same thing. How about that?
Yeah, thanks, John. Have a good day.
All right. Take care.